Put Me in the Zoo by Dr. Seuss includes a guy with big red dots. How would you like to have an allergy that sent you to the medical zoo or the hospital? Well, that's exactly what happens in Stevens-Johnson syndrome. I'm credible to give this speech because I've done enough research to know what the symptoms and what I'm going to inform you. In this speech, I'm going to inform you about what Stevens-Johnson syndrome is, the symptoms, the causes, what tests and diagnosis, and the treatment of this disorder. First off, what is it? It is a rare and serious skin disorder. It burns the skin from the inside out. Blisters form everywhere on top of and under the skin. There are certain symptoms that you look for before and during an outbreak. The symptoms during the outbreak include facial swelling, tongue swelling, hives, skin pain, a red or purple skin rash that spreads within hours to days, blisters on skin, and mucous membranes, especially in the mouth, the nose, and the eyes, and shedding or sloughing of the skin. The symptoms to look for before the rash occurs are fever, sore throat, cough, and burning eyes. You should see a doctor if you experience any of the following symptoms: unexplained widespread skin pain, facial swelling, blisters on skin, mucous membranes, hives, tongue swelling, a purple or red skin rash that spreads or shedding of your skin. Stevens-Johnson syndrome requires immediate medical attention. Now that I have explained what the disease is and the symptoms of the disease, I will now explain the causes. The exact cause cannot always be identified. The condition usually stems from an allergic reaction in response to medication, illness, or infection. Medications are the most common cause of Stevens-Johnson syndrome. The most common types of medicine that can cause an outbreak are anti-gout medications, NSAIDs, which are non-steroidal anti-inflammatory drugs, penicillin, and anticonvulsants. The most common infectious causes are herpes, influenza, HIV, diphtheria, typhoid, and hepatitis. Stevens-Johnson syndrome may also be caused by physical stimuli, such as radiation therapy or ultraviolet light. There are two main risk factors when considering Stevens-Johnson syndrome. The first risk factor is your existing medical condition, and the second risk factor is genetics. Now that we've talked about the risk factors and the symptoms, there are tests, diagnoses, and treatments that go along with this disorder. Doctors can often identify Stevens-Johnson syndrome based on your medical history, a physical exam, and the disorder's distinctive signs and symptoms. In order to confirm a diagnosis, your doctor may take a tissue sample of your skin, which is a biopsy, for examination under a microscope. Stevens-Johnson syndrome requires hospitalization, often in an intensive care or burn unit. There are two ways to treat Stevens-Johnson syndrome. The first one is to stop medicinal causes, which would be stopping any medicine that would cause an outbreak. The second way is to treat it through supportive care, which can range from anywhere from wound care to rehabilitation. Medicines are also given to treat Stevens-Johnson syndrome. The medications that are used are pain medications, antihistamines, antibiotics, and topical steroids. At this time, there are treatments that are being studied. Those treatments include intravenous corticosteroids, immunoglobulin intravenous, and skin grafting. In this speech, I informed you of what Stevens-Johnson syndrome is, its symptoms, its causes, the risk factors, treatment, tests, and diagnosis. This disorder is something to be taken very seriously, as you can see in the picture. If you would like to see more of the phases of this disorder, I have a video on YouTube of my boyfriend, Steve, who was recently diagnosed with this disorder. I will paste the link in the discussion for it under my speech.